Welcome to Brainetainment, your go-to channel for intriguing and informative content that enlightens and entertains. As always, our quest for knowledge knows no bounds, and today is no exception. We are venturing into a rather sensitive yet crucial topic, discussing the 5 reasons why men lose their testicles. Now, don't be taken aback. This is not a matter to be snickered at or dismissed offhand. It's a subject that touches on male health, a topic that is often shrouded in silence and unnecessary stigma. It's essential to understand these reasons, as knowledge is power, and in this case it could very well be life-saving. We will delve into medical conditions, unexpected accidents, and even some genetic factors that could lead to such a situation. So, if you're ready to take a deep dive into this intriguing topic, buckle up. You're about to embark on an enlightening journey. First on our list is the big C, testicular cancer. Testicular cancer is a disease that strikes at the heart of masculinity, often leading to the removal of one or both testicles. It's a frightening prospect, but understanding it can be the first step towards prevention and treatment. The testicles are responsible for the production of sperm and the male hormone, testosterone. When cells in these organs begin to grow uncontrollably, they form a mass called a tumor. If left unchecked, this tumor can become cancerous and spread to other parts of the body, a process known as metastasis. Testicular cancer most commonly affects men between the ages of 15 and 35, but it can occur at any age. It's relatively rare, accounting for just 1% of all male cancers. But despite its rarity, it's the most common form of cancer in men between the ages of 20 and 34. So what are the symptoms? They can vary, but common signs include a lump or swelling in the testicle, a feeling of heaviness in the scrotum, a dull ache in the lower abdomen or groin, or a sudden collection of fluid in the scrotum. If you experience any of these symptoms, it's crucial to seek medical advice immediately. Now, let's talk about prevention. Regular self-examinations are key. By familiarizing yourself with the normal size, shape, and weight of your testicles, you can detect any changes early. It's best to perform these checks once a month, preferably during or after a warm bath or shower when the scrotum is relaxed. Treatment for testicular cancer usually involves the surgical removal of the affected testicle, a procedure known as orchiectomy. While losing a testicle can be emotionally challenging, it's important to remember that men can still lead a normal life, have children, and maintain a healthy sex life with just one testicle. Remember, early detection can save lives. Regular self-examinations and immediate medical attention at the sign of any changes can make a huge difference in the fight against testicular cancer. Knowledge is power, so arm yourself with the facts and take control of your health. Next up is a condition known as testicular torsion. This might sound like a term out of a medical textbook, but it's a very real and serious condition that can lead to the loss of a testicle. So what exactly is testicular torsion? Well, in the simplest terms, it's when a testicle becomes twisted in the scrotum. Imagine twisting a balloon on a string. That's pretty much what happens, but in a much more sensitive area. This twist cuts off the blood supply to the testicle, which can cause severe pain and swelling. But what causes this? It can happen due to several reasons. Sometimes it's just a matter of the way you're built, with some men having a higher risk due to a genetic predisposition. Other times it can be caused by physical activity or an injury. Even something as trivial as turning over in bed can trigger it. Now, onto the symptoms. The most common one, as you might guess, is severe pain in the testicle. This can come on suddenly, or it might develop over a period of hours. Other symptoms can include swelling, abdominal pain, nausea, and even vomiting. So you might be wondering, is this really that serious? The answer is a resounding yes. Testicular torsion is a medical emergency. If left untreated, it can lead to the loss of the testicle. The lack of blood flow can cause tissue death in as little as 4 to 6 hours. This is why it's absolutely crucial to seek immediate medical attention if you suspect you might be experiencing torsion. The good news is that surgery can often fix the issue if it's caught early enough. The bad news? There's no surefire way to prevent torsion. However, wearing protective gear during sports and being aware of the symptoms can go a long way in ensuring you get help in time if it does happen. So, the bottom line is this: time is of the essence when it comes to testicular torsion. It might be an uncomfortable topic, but it's one that's crucial to understand. After all, knowledge is the first step to prevention. Severe trauma is another reason men may lose a testicle. You might be wondering, how serious does an injury have to be to result in such a drastic outcome? Well, the answer is quite serious indeed. Consider this scenario. You're playing a friendly game of football, the ball's in the air, you're running for it, and then, pow! A misguided kick lands in an extremely delicate area. This could lead to a severe testicular trauma, causing damage that might result in the loss of a testicle. Now, I'm not saying that every little knock or bump will lead to this outcome, but high-impact injuries can indeed pose a significant risk. It's not just sports either. Accidents in everyday life, from falling off a bike to a misstep on a staircase, can lead to severe trauma as well. This is why protective gear is so important, particularly in sports or other high-risk activities. A good quality athletic cup or groin guard can be the difference between a painful inconvenience and a life-altering injury. In the grand scheme of things, it's a small price to pay for safeguarding such an essential part of your anatomy. After all, we don't think twice about wearing a helmet while cycling or a seatbelt while driving. It's the same principle. So remember, whether you're stepping onto the football pitch, hopping on a bicycle, or even just going about your day-to-day activities, take a moment to consider your safety. Because as the old saying goes, protection is always better than cure. Infections are also a contributor, particularly orchitis and epididymitis. Let's delve into these terms. Orchitis is an inflammation of one or both of the testicles, typically caused by either a bacterial or viral infection. On the other hand, epididymitis is an inflammation of the tube at the back of the testicle that stores and carries sperm, often caused by sexually transmitted infections or urinary tract infections. Symptoms of these conditions can range from mild discomfort to severe pain in the testicular region, swelling, redness, fever, and in some cases painful urination. These symptoms can be quite alarming and should not be ignored. Immediate medical attention is essential to mitigate the risk of complications. In severe cases, if left untreated, these infections can lead to abscess formation or even testicular necrosis, a serious condition where the tissue in the testicle dies. In such instances, removal of the affected testicle may become necessary to prevent the spread of the infection or to save the patient's life. But as with many health issues, prevention is better than cure. Regular self-examinations, practicing safe sex, and seeking prompt medical attention when symptoms arise can help prevent these conditions from reaching a stage that requires removal of the testicle. Remember, your health is in your hands, and early detection and treatment can make a world of difference. Prevention and early treatment of infections are key. Lastly, we have a condition known as undescended testicles. Now, this is a condition that occurs when one or both of a man's testicles fail to descend from the abdomen into the scrotum before birth. It's most common in premature births, but can also occur in full-term births. The main risk posed by undescended testicles is the increased likelihood of testicular cancer. The testicles are designed to be at a certain temperature for optimal sperm production, and being inside the abdomen can cause them to be warmer than they should be. This can potentially lead to abnormal cell growth and eventually cancer. Another risk is infertility. If both testicles are undescended, it can lead to a lower sperm count or even complete absence of sperm. In certain cases, a minor surgical procedure can correct the issue, but in instances where the testicle is abnormal or damaged, removal may be necessary to prevent further complications. Regular checkups can help catch this condition early. So gentlemen, don't shy away from your health checks. So there you have it. 5 reasons why men may lose their testicles. We've navigated through this complex topic together, from the frightening reality of testicular cancer to the less known but equally serious condition of testicular torsion. We've also touched on the impact of severe trauma, which can happen in a split second but have lifelong consequences. In addition, we've looked at the infections of orchitis and epididymitis and how these can lead to the loss of a testicle if left untreated. Lastly, we discussed undescended testicles, a condition present at birth that can result in the loss of a testicle later in life if not addressed promptly. Each of these reasons is a testament to the importance of regular checkups and taking care of our health. Remember to subscribe to Braintainment for more enlightening and entertaining content. Stay informed, stay healthy.